I'm a postpartum nurse and I want to talk to you about low blood sugars in newborns and why we would check your baby's blood sugar after delivery. So babies who are small for gestational age or less than 10th percentile, large for gestational age greater than 90th percentile, if mom had beta blockers during her third trimester of pregnancy, if the baby had PPV or positive pressure ventilation as a resuscitation measure at delivery, if the mom has gestational diabetes or diabetes prior to pregnancy, if the baby is late preterm, which is the gestational age of 35 weeks to 36 weeks and 6 days, or if your baby just shows signs of low blood sugar like jitteriness, poor feeding, lethargy, blood sugars could be checked then as well. We check blood sugars because if a baby's blood sugar is too low for too long and it's not treated, then the baby could have brain damage or developmental delays. The typical way blood sugars are checked is through a heel stick. We do the first heel stick around 90 minutes of life after that first feeding, and then around every 2 to 3 hours after that before feedings. Blood sugars are usually checked for about 12 to 24 hours. It really depends on why your baby's blood sugar is being checked and what the protocol is at your hospital. If your baby's blood sugar is low, that can typically be treated with refeeding, glucose gel, which is a sugary gel that gets rubbed into the mucosa of the mouth. In extreme cases, if the blood sugars are too low or it's prolonged and they can't get it to come back up with measures on the mother-baby unit, your baby could end up in NICU for observation or admitted to the NICU if IV dextrose is needed. I always tell my patients to keep your baby warm when your baby's on blood sugar protocol. So if your baby gets too cold, they can put cold stress on their body and it can make them lose their glucose reserves more quickly. So keeping that room warm, and I know it's so hard, especially postpartum when you are so hot, you just want to have a fan blowing right on you. But when you're holding that baby, you don't want to have the fan blowing right on you because you don't want that baby to get too cold. Lots of skin to skin, whether it's mom or dad doing skin to skin. That skin to skin is so good to help your baby regulate their blood sugar and their vital signs. If you're doing skin to skin, make sure you've got a couple blankets over the baby's back so the baby's not losing any body heat from his back. And then if you are just exhausted, which I get, don't sleep with your baby. Bundle your baby up, or have your nurse bundle your baby up and put them in the bassinet. That way they stay safe and you can sleep, but they also stay warm. A way to make the heel stick a little more comfortable for your baby is to do skin to skin during that procedure. Anecdotally, I have noticed babies cry less having their blood sugar checked when they're on their mom's chest versus just lying in the bassinet. Be sure to hit follow so you can get more newborn care tips from Mother Baby Nurse.